why we're having these discussions. I was having a little brainstorming session with her, and she was talking about how hard it is to get out and meet people in the pandemic. And I asked her, well, who are the people that you want to meet? And she's like, aging life care managers. I was like, you're not the only one that said that to me. Why don't we do a monthly discussion? And it was born out of that. So welcome, Donna. And for those that don't know you want to share a little bit about your background, and then we'll bring on the panel.
Sure, I'm happy to. Welcome, everybody. We're so happy to have you here. Just to tell you a little bit about myself, I am a senior living veteran. I've been in the industry for quite a number of years in sales and marketing positions. And I've known Steve for probably a little over 20 years. And I would say the big difference between Steve and I is that I dye my hair and he doesn't. So, so anyway, I'm just so thrilled to be here. And, one of the things I wanted to say was that really caregiving will never be a one size fit all. And with that notion, I would say that, care managers are the same. I think they're all a little bit different, as I've learned throughout the years in my career in senior living. And so I think the importance of this discussion today is to learn kind of a little bit about each one of them and how maybe they are a little different, and get to know them. So I'm really excited to be a part of this, and welcome everybody. Thanks for coming.
Great. Awesome. And so let's see, I've got our panel members on my screen here. I'm going to stop sharing and ask our panel members to come join us. And there is Susie Murphy. And just so you guys know, Susie is the one that picked this date, and big surprise with a last name like Murphy that she would do that. So guys, the way that we kind of have organized these sessions is in sort of 3 rounds. First round is let's get to know the care managers. Second round is they share their insights and observations. And then third round is all about you asking questions and driving the discussion in the areas that you want to dive into. And so let's get started with round 1. And I'm going to start with Susie. Susie, tell us a little bit about your story, how you came about becoming an aging life care manager and the practice that you're a part of.
Sure. Thanks, Steve, and thanks, Donna. And it's just really an honor to be here with Kate and Denise, who are just very treasured colleagues, and we all do the same kind of thing, but in a different geographic region from each other. So I really came to working with older people, not because I had a experience caring for older relative, but really the opposite. I was lucky to grow up with all 4 of my grandparents, and they were very active and engaged in my life. And so I grew up just kind of thinking old people are really cool and smart and do all kinds of things. And when my children were really young, I was looking for a part-time job that would be flexible around taking care of young kids. And I was introduced to Levy by an elder law attorney, and started out. My first client was actually the first woman to, Caucasian woman to ride bareback on an elephant in the circus. She ran away from home when she was 16 and rode the elephant. And she was just a very interesting person. She'd been married multiple times, had kids. She left the husbands and the kids behind, and ended up in her older years with the guardianship and in a group home. And I used to visit her and bring her books about the circus. And it hooked me, that first experience with her. And I just celebrated this month in March, actually, my 28th anniversary with Debra Levy, Eldercare. So I worked for Debra first part-time, then full-time, and then in 2012, she was diagnosed with a brain tumor that was inoperable and died 3 months later. And I was her wish that I take over the company, which I have, and I've grown it now. So we have 14 care managers, nurses, social workers, and gerontologists. And when I took over the company, I also became more involved in our association, the Aging Life Care Association. And I was really honored to work with Denise when she was president as her president-elect, and also honored to lead our local chapter for 2 years.
Great. All right.
All right, are we gonna go to Katie Caldwell, CEO of ElderTree? Katie, tell us a little bit about yourself.
Thank you so much, Donna, and thank you, Steve, for having us today and highlighting aging life care managers. And I hope that in this conversation today that everyone realizes it's not just the elders that we want to support, it's definitely team members like you and people that work in the field that we really want to connect with and support in serving all the seniors out there. But long story short, so I am really lucky in the sense that I've always known that I love to work with seniors. In high school, I worked as an activities assistant in a nursing home. And then later went on to get my master's degree in gerontology. And then when I arrived here in Virginia, one of my first jobs was with Sunrise Senior Living. And I know so many of you out there also have been a member of the Sunrise Senior Living family. Learned a lot there, and then started my business 16 years ago when my first son was born, Nick. So business and baby, don't highly recommend doing both of those at one time, but I'm here to talk about it. So apparently it all worked out. I started the business for two reasons. One was work-life balance, and I'm still really striving for that in the company today, and to create that for my team members. And then the other was just this really deep passion for wanting to make a difference in the field of elder care and really wanting to focus on person-centered. And I know you guys, we talk about this a lot here, but person-centered care management where the elder is at the center of the care plan. So thank you so much for having us today, and I look forward to the conversation.
Awesome. Thank you. Thanks, Kate. And before I introduce Denise, I want to thank Kate Caldwell for a couple of reasons. Is because when this pandemic hit, I started getting a few calls about like, hey, what are you going to do with your live meetings? But what really put me over the edge is when Kate called me and said, what are you going to do about the live meetings? And she was really the cat, because I know when an aging life care manager brings up a topic, there's a lot of relevance to that because they're working with so many different types of clients. And then to make it even better, she heard a podcast with Bill Thomas, who we're going to meet live on April 8th. And we kicked off one of our first sessions was sort of talking about Bill's thoughts on aging and the pandemic. And I'm really psyched that we're going to get him live on April 8th, and Kate is going to co-host that one with me. So thanks a lot, Kate. It's wild to think this ride that we've all been on for the last year. So with that, Denise Valerio, another care manager that I've known for years. But Denise, tell the audience a little bit about your journey and how you got to where you are.
Great. Thanks, Steve, and thanks, Donna. And just a tremendous honor to be here with Kate and Susie, who have been colleagues for many years of mine. So I'm actually up here outside of Philadelphia, where I had my own care management practice, Valerio Care Management, for 15 years. And at the beginning of this year, I made a very terrific decision to merge my business with the Option Group, which is based out of Hunt Valley, Maryland. Ellen Platt is the president and owner of that. And so by trade, I'm a licensed social worker, and I've been in healthcare for almost 40 years and been doing care management for about 30 of those years. And it truly, social work, number one, is truly my calling. It is really what gets me up in the morning and has always been just kind of a part of my personality, and really allowed me to evolve and develop into the role of an aging life care manager, providing services to the aging adults and also services to the disabled adults who also have their own challenges. So as a care manager, again, I've worked independently, have excitingly moved into the Option Group, and it allows us to widen our footprint of providing services not only in Maryland, but up here in Pennsylvania, outside of Philadelphia and York, Pennsylvania. So I still like what I do. So even though we have exhausting days, I still really like what I do. So I think that's a good sign.
Awesome. Great.
Thank you.
Okay. Well, Donna, that closes out round one. We know our panel members. So now let's dive into what our panel members know and share with the audience. And I'm going to throw up a slide on the screen. And Susie, do you want to kind of kick off the second round with telling us a little bit about this slide and what it means to your profession?
Sure. So I think I'll start with one area of confusion that a lot of people have, that case managers and care managers are interchangeable. Case managers, typically you'll have a case manager while you're in the hospital, and their job is to get you out of the hospital, whether that's to rehab or home. Or if you have a chronic condition, maybe diabetes or congestive heart failure, through your insurance company, you might have a case manager, and they're really guiding your care for that illness. But in both of those situations, they're not necessarily looking at all of these different knowledge areas that aging life care managers specialize in. So if you're trying to manage your diabetes, nobody asks you if you have your powers of attorney in place, for instance. Or do you necessarily even ask, do you have enough money to get the glucometer and the other supplies that you need? So aging life care managers are unique in that they work in all of these different disciplines. So when we're looking for solutions, we want to make sure it's what you can afford, that it meets your psychosocial needs, your medical needs. We're there to advocate for you. And if you don't have things like your estate planning or powers of attorney in place, we can connect you with an elder law attorney who can help you with that. The other thing that distinguishes aging life care managers from other folks who might be out there just trying to help or might be a quote unquote free service is that we all follow a code of ethics, and we don't have a financial relationship with any resource that we recommend. So our recommendations to you are very individualized based on your needs and your preferences. You pay us, and we don't have a financial relationship with any resource. And I think that's very important, and that really sets members of ALCA, the Aging Life Care Association, aside from other folks who may be trying to help you with challenges of aging.
Great. Let's see. Any of the other care managers want to jump in on thoughts on that? And then also tell us a little bit about these 8 knowledge areas, Susie, or any of the panel members.
I think one of the other myths that's out there is that care managers are very expensive, and that if you hire them, you have to hire them for a long time. And all of us, Kate, Denise, and I, you can hire us for as little as an hour. And then I also have relationships with families that have gone on for more than 20 years, multiple people in the same family. Even now we're getting into multiple generations. So we're really all experts in our geographic region and can help in our clients in all of these areas.
And the other, this is Kate, I'm not sure if it's going to pop up there, but the other myth too that I think people think that aging life care managers only work with family members that have a lot of resources. And I have to say that about 15 to 20% of the clients that I work with in my group have low income resources, and we're actually helping them to navigate that, because that's extremely complicated in getting your auxiliary grant or your aid in attendance or your waiver, and it's different per area. So it gets complicated and different in DC, Maryland, Virginia, you know. So that's something that people don't always know.
Yeah, and this is Denise speaking, and just to sort of dovetail on Susie's point about the role of a care manager, it is unique unto itself. And when I do a meet and greet with a prospective client or a family member, one of the analogies I use, and I think it is really one of the strengths that care managers bring to the table, is we're able to pull the team together that is going to address the needs of that client for today, for tomorrow, and for the future. And so the analogies I use is, I say to people, my role is to come in and assess and be able to determine what that person's needs are, and then to set up plan and care in place that can address all those, whether it's spiritual, mental, medical, mental health needs, psychological needs, whatever those care needs are. I get to work. If you're a sports fan, I like to look at the care manager as the quarterback of the team. And if you like music, we're the orchestra leader, we're the conductor. And we really help to put all the pieces in place and make sure that all the wheels are moving in the same direction at the same time. So in terms, like, I'm a big picture thinker. So case management, an honorable profession, but they're really focused on hitting that task and goal and then moving on. Care management can be involved with you. A care manager can be involved with you for days, weeks, months, sometimes years. And it's really looking at the big picture and trying to make sure that we're keeping people independent. And what drives our process is safety, keeping that client safe, no matter where they call home.
Well
If I could
said.
If I could just add something too, as someone who's been in senior housing for a while, and I know we've got so many people on this call that are, in some form of senior support services, whether it's home care or senior living, is that, aging life care managers have been an amazing resource for us, especially from my standpoint of being in sales and partnering with aging life care managers when we're working with families who are really struggling and we can see that they need more help than just simply touring a community. I found that partnership has been really amazing. I've seen financial advisors partner with aging life care managers to help their clients as well. So I feel like there's so many benefits to, knowing you and using you as the excellent resource that you are to help our clients. So.
Donna, I love that you brought that up. And I actually had that on a point that I wanted to mention to folks is like, I know my door is open for calls or emails. If you are looking for a resource for someone, maybe it's not necessarily that it's going to become a client of ours, but we as care managers really want to serve the community and, our knowledge base. And we've, worked hard to create this knowledge base and know all the little details out there. Maybe you're looking for a podiatrist that will come to somebody's home, like whatever it is. I think all care managers are willing to help out. So please feel free to reach out to us and, even if it's not a referral, it's more just like, hey, this person needs a specific resource. We're happy to help.
That's a great point, Kate. And also because we're all members of the Aging Life Care Association, there are over 2,000 of us across the country. And I know I get emails every week, either from clients or other colleagues. Do you know somebody in San Diego, or do you know someone in Chicago, up in New York? And we all refer to each other because we know that we have the same code of ethics and that we do the same thing. Perhaps some of us with a slightly different approach based on if we're more nursing oriented or social work oriented, or our group may have both disciplines. But we always want to connect people to the resources that will help them.
And to your point, Susie, we have care managers, we have colleagues up in Canada, and we also have them, overseas in Europe. So we're, our national listserv will ask us sometimes if we know a care manager in Israel, over in France. So it's just fascinating. And when it works, it works. And that's what keeps us all in the game. When it works, it really works well. And it truly serves that client well and gives their loved ones that peace of mind that all of us are looking for.
Yeah, and I've heard quite a few stories over the years of folks that might be sort of helping mom and dad make a decision, and there are multiple geographic options, of mom staying where she lives or moving to the location where the kids live or some other place. And heard some great stories of where care managers have been able to help folks with these long distance situations. But I think another thing, I'd be interested in your comments on that. But one of the other things that I think that is always a good thing to bring up is that oftentimes the adult children are the ones calling you, but they're not really the client. Am I correct in sort of stating that?
Yes, 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 yes.
And often they want to be part of that initial assessment, and I'll invite them to be part of it, but I'll suggest that they let us be alone for a while, because there may be things that the client wants to share with us that they don't want to share with their adult child. And that happened to me once years ago. And the daughter at first was like, really? And I said, yeah, I mean, I just don't know what your dad is going to want to say, you know, to me privately. The minute she left the apartment, he went to me, he said, I've got a deep, dark secret. I was like, oh my gosh. But his deep, dark secret was, his daughter had told me she was being treated for breast cancer. He was very worried about her, and he'd gotten into a fender bender and he couldn't navigate getting his car to get the bumper repaired and get back again. And he needed my help with that. And so I did, and we got it to the body shop and got a rental and got it all sorted out. I kept that secret for him until he died. And I saw his daughter when she invited me to be part of the Shiva. And I said, so I have a little story to tell you about your dad that I promised him I wouldn't tell you. And I told her, and she said, you know, I wondered about that. I saw his car and it was all banged up. And then a month later, it was fine. And I figured you probably had a hand in that.
Great. Let's see. We're starting to get a few questions coming in here.
Yeah.
Donna, how about you take the one that came in Q&A?
Sure. So this question came in. I've recently had a couple people ask me about families that are looking to have care managers assist their loved ones that are struggling with substance abuse. Does anyone on the panel get involved in that, or is there anyone else seeing referrals like that?
Wow.
And this is from Karen Irwin.
Yeah, really important topic, because everything that I've read says we're all drinking a little bit more with this new. Have you all experienced any of that in your practices?
Yeah, so this is Denise. So Karen, a shout out to Karen. She's from up here in my neck of the woods. And so it's interesting because I've been seeing over the last few years, not so much with the pandemic, but I'm seeing two things. That the dirty secret of the family member, the client drinking too much, or over medicating with a prescription drug, and are starting to bubble to the surface. And also what I'm seeing is, you know, that the secret of, you never talk about the depression or perhaps, you know, the existence of mental illness with mom or dad and the loved one. And I think that people are living longer. So in my opinion, at some point, all of those things start to really come to the surface. And so, you know, I've experienced my share of clients who, in my assessment or in talking to them or in talking to their family members, this stuff comes out. You know, this stuff comes out about abusing their prescription medications. And I have a client who I for the last 6 weeks have taken over filling his pill box, because he drug seeks and he likes to take the pills that make him feel different. And he really doesn't want to take the ones that are treating a medical condition. So it's balancing that out to make sure that, you know, and he happens to be a recovered alcoholic. So that's on my radar. You know, that's on my radar. There's a particular behavior sometimes that addicts or alcoholics will exhibit. So yes, I think that's a fair question, Karen. I think that those folks are out there. And if we're doing our assessment thoroughly and asking the questions, sometimes the tough questions that need to be asked, those are coming up to the surface, and I think it's going to continue to challenge aging life care managers around those issues.
Yeah,
Yeah.
I would agree. And, you know, with that, we often get clients who start to have a dementia that's related to years, sometimes decades of alcohol abuse. We had one
Good point.
client who crashed his car and had been drinking and driving. And ultimately, you know, we gave him the option of continuing to drink or continuing to drive. He gave up his car. And so that was at least, you know, he just flat out refused to give up the drinking. So our job and the job of his caregivers was just to keep him safe.
Mhm.
We tried a treatment program, and for him, he made the choice. It was very hard on the family, but we are seeing a lot of that, like Denise said, either the alcohol or medications or a combination.
You know, I've had clients as young as 29, typically with an MS diagnosis, and you know, this is before medical marijuana became, you know, something that is starting to be embraced, and that's how he got through the day. You know, just, you know, getting high and getting through the day. And I'm not about to judge that. I'm about to just help. You know, I helped him and his mother be able to find the balance between that, psychotherapy, and making sure that he took all of his MS meds. Again, it's quality of life that all strive for, whether you're the client or the caregiver. But those issues, you know, they're alive and well. They're alive and well out there.
Great. And I really like to see how the audience is following up in the chat. Lori from Advanced Senior Solutions says that she's had numerous clients with alcohol and drug abuse. And Jeannie from Grand Oaks is giving a shout out to Martha Gaston with Seabury, who helped a friend of her sister, another care manager that helped with where alcohol and drugs were an issue.
The other piece of this too is we're finding, you know, we are having the same issue. We're seeing a lot more of this. And when we're looking at some of these really beautiful new communities and we're like, oh, look, there's a huge bar, you know, it's challenging because that means we can't, you know, there's some clients that we just can't have go there because that's the center of their meeting area. So just something to think about.
Yep. Okay, questions are coming in fast and furious. So Donna, you and I we'll tackle these one at a time. I'll start with Jean Hers, and she says, when should we begin interaction with care managers? I'm 78, my husband is 81. We're fully functional, but realize in the future it might be different. My mother developed Alzheimer's at age 80. And Jean, I would love to give you an award for just coming on this discussion. Absolutely. And being brave enough to think this way and ask that question, because I'd love the care managers to comment on how early you could consult with a care manager, but then also maybe talk about the opposite of that when you don't. When you wait to the last minute and the crises that can ensue.
I'd love to jump on that first if I could, Steve. So Jean, what a great question. And again, you had the courage to ask the question. That's great. Because that's part of the bump we have sometimes, you know. How do we start the conversation? I have had interaction with many folks in your age bracket who call me and want to know about the services and say to me just what you said. I'm okay now. There's nothing really going on. We're in good health. We're managing all the parts of our lives. How about we meet and at least, you know, get past the meet and greet and do an assessment. In my practice, I'll do an assessment, go out and meet the folks, and at least have a face and a name with each other. And know that I am their contact person, and they may not contact me for several years, but at least they're on my radar. They're in my file cabinet. I know who this person is. It's sort of a give and take. If I don't reach out to them, they'll reach out to me if something changes in their life. Sort of it's sort of like having an insurance policy that you don't want to tap into, but when you do, you know that you've got that. It's not going to be a stranger that you're calling or a stranger coming into your home. And I would suggest to you, Jean, that think about maybe finding somebody that might fit into this practice and see if you can at least develop a relationship for the future. But better to start this process when there's not a crisis, so that we're jumping in around triaging the problem before we can really get to the meat of what's going on with that person. Those are my thoughts.
Yeah, I agree, Denise. And we actually created a program exactly for folks like Jean called our Well Senior Program. And we have over 65 people enrolled now.
Wow.
And maybe a third of those have enrolled since the beginning of the pandemic, because these are folks who may be living alone at home or don't have family, or family is far away. And they realize, what if I got sick with COVID? Who would come to the hospital? Who would feed my cat? Who would take in my mail? Who would advocate for me in the hospital? So our Well Senior Program is designed exactly for those folks, so that we stay in touch with you throughout the year. And then again, if there's a challenge of aging, we're ready to jump in and help.
Thank you. Those are such great answers. We do have so many questions. I'm going to jump to the next one, which is, how do you find and review people to serve as your client's power of attorney when your client has no family or other people to serve them in this capacity?
This is a really great question. You know, most care managers don't serve as power of attorney, but many care managers will serve as healthcare proxy. So some care managers will do guardianship and powers of attorney as well.
Yeah, I'll just jump on Kate's coattails there. So in my practice, I am one of those care managers. Most care managers either aren't comfortable or they don't have an interest in becoming someone's power of attorney, but I do take on that role, both for financial agent and also healthcare agent. And I also do guardianship, court-appointed guardianship cases. And it's a whole different ball of wax, and can take up use more emotional energy for those kind of cases than just someone that comes in who's really seeking care management services. But what's nice is when I become someone's power of attorney, I'm able to then partner with a care manager in the area here that can do, if I determine that they need care management services, I'm able to partner with the care manager in the area to provide the care management services, and I oversee the whole administration of the POA documents. So it can work really, really nicely.
And just to jump in, we work with a number of elder law attorneys, and often they're willing to serve as power of attorney, but they would like to know that their folks have a relationship with the care manager, because they're not medical experts, but
That's
they're able to be on call. And so we do get a lot of calls for people who, for whatever reason, either they don't have friends or family, or they just feel uncomfortable burdening them with that responsibility. So we can usually find someone, accountant, attorney. Sometimes we will serve as healthcare proxy, like Kate said. So it's definitely a question we're getting more and more often.
Okay.
Great point, Susie. Great point.
And we've got Paula Gallerin has her hand raised. I'm gonna allow her to talk, but while I'm doing that, I'm gonna read another question from Deb Merrimer. And Deb says, "We're so grateful to you care managers. We hired one in Pittsburgh to assess my mother-in-law, and she was a great resource to the family. She's now in an assisted living community. Can you explain the role of care managers when somebody moves to a community?" I think sometimes people view just hiring a care manager just to help make a move, but how do you guys work if somebody is living in one of these communities?
Well, Do you want to go ahead, Denise?
Yeah, go ahead, Susie. I'll follow up. Go ahead. Thank you.
Yeah, so for some families, really, it is that task. You know, I know my mom has some memory issues. The doctors say she shouldn't live at home anymore. And we just help them with that transition, help them find the right fit for their mom. But in other situations, maybe the family is far away, or maybe there's a guardian or an attorney serving as power of attorney. And they're like, I don't have time to visit and I don't know how to evaluate the care. So I've had clients that I visited weekly, you know, in memory care or in skilled nursing or in assisted living, and we're advocating for their needs. They're making sure that they get things like their podiatry care and get out to the dentist, get their flu shot. Right now, of course, it's getting their COVID vaccine. So we definitely can continue that relationship once somebody is in assisted living or skilled nursing, but needs an advocate or even just a friendly visitor.
And the other piece of it is to, if that person were to go out to the ER, so we're on call 24/7. So if someone goes from assisted living to the emergency room, there's not really any staff member to go with them. So we show up at the emergency room and make sure that they are taken care of from there.
Great.
I never forget, I had a client once who had pretty advanced dementia, but she went out to the ER and I met her there. And when she saw me, she was all excited and she started talking to me. And the doctor came in and she said, she talks? And I said, yeah. And he said, oh, she wouldn't answer any questions from us. I said, well, she doesn't know you. She's known me for a long time. And they were, you know, they were treating her in a very different way. They thought maybe she had a stroke because, and she, you know, she did live in memory care, but her responses to strangers were very different than when there was somebody she knew.
All right, we've got Paula. Paula, your mic is open. So you had a question for the care managers?
Oh, yeah. I'm not really sure what I need, but I think I need an initial consultation with maybe a geriatric social worker about, and I'm mainly interested in housing. And I just need to ask some questions. I don't know what I need to do. And I'm wondering if a care manager would be the right category of person or something else.
Great. Well, really great question. And Paula, what I'm going to do for everybody is we'll send out contact information for this panel, but then also I'll send a link to the Aging Life Care website where you could do a search. But maybe if the panel members could comment on somebody like Paula who doesn't know who to talk to or where to turn, what happens when she just gives you guys a call? Like what can be the expectation?
Paula, it's a great question, and thank you for raising it. And so I don't know where you reside, but it just by how you've described kind of where you're at, what you're looking for. Starting off with an aging life care manager, geriatric care manager is certainly an important first step that you should consider doing. So perhaps you live in one of the areas where myself or my two colleagues live. And if not, as Steve said, you know, we're happy to at least give you what I get calls a lot from across the country looking for a care manager for someone in another state, but I'm able to plug them into someone who I could recommend. So, you know, all of us would be happy to help you find someone who would fit into your what your needs are.
Yeah, I'm in Virginia.
Okay.
So then Kate would be your gal.
Yeah, I'd be happy to help you out and get you to the right place if I can't help you.
Great. Thank you, Paula. Thank you.
And just a reminder that, you know, Paula, if you were to work with Kate, she would be looking at your finances, your needs, what you like, the amenities you would prefer. So you would be paying her for your expertise, but knowing that there would be no financial relationship so that, you know, wherever you end up, it's the best fit for you. People often ask me, just tell me where you would put your mom, and then that would be fine. And I'm like, have you met my mom? Because you might really not want to live where she's living. So
absolutely. And most care managers work, like you can call them, they're going to talk with you for half an hour to 45 minutes. And
That's
even
right.
if they're not the right fit for you or they can't solve your problem, then they're going to give you resources. So, I
That's
mean,
right.
you can't really lose. You can't
That's
lose.
right. It's a
Right.
win-win. That's right, Kate.
Yeah.
Said, well said.
Donna, you want to jump on one of the many questions that are coming in?
Yeah, they're pouring in. So this question is from Adele Logan Galen. She says, I'm a senior move manager and work with seniors who are overwhelmed with clutter. Frequently, there is a mental issue going on as well. What is the best way to approach this, and perhaps suggest that they make an appointment with an aging life care manager?
Mm.
We've all been there, right, ladies?
Situations, right?
Oh, yes, we
Yep.
have.
Yeah.
Yeah.
So I would suggest that perhaps you're the conduit. I'm sorry, her name was Angie. Is that what you said?
Adele?
Adele.
Yeah.
Adele, you might want to, your business is also a busy business and can be challenging. And so I've worked with move managers in the past, and when they stumble across something like this, it is most effective, I've found, for that move manager to reach out to me directly, have a conversation. Again, I'm going to give you a 30-minute consultation just to kind of, ferret things out. And then perhaps you're the person that can open the door for the care manager to reach out and call or arrange some sort of meeting to really offer the assessment service, and then figure out, we've got to figure out what those mental issues are, and then we can take it from there. But you might have to extend your hand out to a care manager just to have the conversation about how best to approach that situation.
And tacked on to that question that Adele had is one from Keisha, who says, what are the qualifications to become a care manager?
So again, my background is I'm a licensed social worker and an accredited social worker and a credentialed care manager. And in our association, the larger percentage of care managers tend to be social workers, followed by nurses, RNs, and LPNs. And then we have a mix. We've got many a PT, a physical therapist, or an occupational therapist, or master's prepared counseling. We also have bachelor's prepared social workers, rehab counseling backgrounds. So my background was hospitals and home care and hospice and psychiatric. And so I think, you want to make sure that you have X amount of years. There's a lot of information on the Aging Life Care Association website. Part of what has to happen is that you become certified as a care manager, and you can do that a couple different ways to become certified. But if you're interested in that, I would refer you to the Aging Life Care Association. I would refer you to the National Association of Social Workers. Would love to talk offline if you would like about if you're interested how to step forward into this profession. There's room for so many more of us, believe me.
Right. And we also, our association has a student membership fee, and the Mid-Atlantic chapter, if you know a student or you are a student in gerontologies, social work, or nursing, and you're interested in a career, you can contact us at the Mid-Atlantic chapter, and we have scholarships available to cover that student membership. So you can come to all of our meetings and conferences at the member rate and learn more about the association.
Steve, are you able to link up, since we're all in the Mid-Atlantic chapter?
The link to the chapter
The link to the
website.
chapter. Our chapter website.
I'm gonna, and there's been a few questions about this. As
Okay.
a follow-up, everybody will get the recording. You'll
Terrific.
get a link to the podcast. You'll get a transcript of all the chat messages that are going on. And you'll get contact info for the panel members, but then I'll send the national and the Mid-Atlantic chapter.
Terrific. Thank you. Thank you.
Donna, you want to do another question?
Sure. So this question is from Tara Barnes. Hi, Tara. Your question is, what do you suggest is the best way to educate and to get the word out to our seniors about care management? And I just want to comment how much I love this question because as I was working in senior living, I would often have care managers come out and do presentations to our in-house seniors as well as the general public. But I would love to hear our care managers address that question.
I would say if somebody has the answer to that, I'd like to hire them.
Yeah. Our association is working very hard. You know, we are posting, we're being quoted in the New York Times, major magazines. We are trying to get the word out because we've been around as a profession for almost 40 years. And still all of us on this panel, you know, run into people who've never heard of us or say, oh, I wish I'd known about you when my mom was sick. I really could have used someone like you. So I often say if somebody hasn't heard about us and doesn't know how to explain it, I say, you know, if you were to sell your house, you wouldn't just put a sign in the front yard saying for sale and somebody walks up and says, oh, I like your house. Can I pay you $10,000? Let me write you a check. You would never do that. You would be like, let me interview some real estate agents. Let me figure out what I should do to get the best price. And you have that guide to do this, help you with this big transition. And we're similar, providing a similar role when you're transitioning, maybe considering moving out of your home, downsizing. We're the experts that can help you with those decisions. Our tagline for our associations is the experts in aging well.
Great.
And you are.
And Donna, if you want to pick another question, I'm going to allow Patty Grace to talk, but if you read the question and then we'll address it and then we can bring Patty on.
Sure. So I'm going to say hi to Patricia Debra. She had a question, which is, and I love this one too. It's how can we best support you? Care managers that are doing such an amazing service for our community. So what's on your wish list in terms of how we can support you?
Really good one.
Yeah, that's great.
That's a great question. The only thing that comes to mind is, and I don't know if this is directly related, but when we're able to do the Celebrate Centenarians event again, when all of this opens back up, please come and join us. That supports me.
And I would say we're working with Steve, and he has published a chapter guide that explains who we are and how we work. And so if you're in home care or senior housing, having our guides or having one of Steve's pro-aging guides that explains our profession is also a great way to get help. You know, those folks that come to us through home care, it's often that family where the home care company is getting calls from multiple daughters and sons and so forth, and everybody wants to have a hand in what's right for mom or dad. And we can be the ones that can come in and perhaps provide a more objective view of what the needs are, so that home care company is not having to be the family counselor and order the groceries and take on a lot more than they expected when they first brought a caregiver in.
And, you know, for all the attendees here, I mean, you're learning a little bit. If you didn't know a little bit about aging life care management profession, you're learning a little bit today. And so now you can ask about that, a home health aid company or a home care company or an attorney that you're seeing or a financial advisor. So, you know, we can ask a lot of questions, but we're not always asking the right questions. So you know a little bit about aging life care manager, and to support us, ask the question, ask if they have access. Could they refer you to someone? You know, the schools and the universities, you know, there's a big push with our Mid-Atlantic chapter to really, you know, develop relationships with schools of social work and nursing to bring people on as an internship, perhaps. I'm really excited about that because I think, you know, having done a year of that in grad school, this working in a care management practice would be an ideal placement, an internship for a student. So there's so many different ways to approach this, but ask about an aging life care manager. We used to be called geriatric care managers. We're not just people who come in and, help you do, change a light bulb. We have people that can do that, but we're really about trying to set up a plan of care that meets all of the needs of that person. And I feel sometimes we are like the best kept secret. Support us at healthcare fairs, support us, if you're somewhere and somebody's asking about, I've got, an elderly parent, who can I turn to? We are a tremendous deep resource for everyone.
Great, great. All right, we got Patty, Patty Grace, your mic is open. You had a question?
Well, I did have a response to when you were speaking about how you can, get the word out and help people to understand what your service is. I mean, social media is a great way of doing that. It's a great way of educating people, as Denise was just saying, that could possibly refer to you. It's a great way of getting your message out of what you do. Putting up testimonials. So using social media to your greatest advantage, either to cultivate professional referrals, to reach out to your family members, to reach out to the public at large. I just don't see your industry necessarily using that to the best of your abilities. And that is a very easy way and a very succinct way of getting your message out to a broad audience. So that's what I wanted to share.
Yeah, good suggestion.
Thanks, Patty.
All right, thanks, Patty. Okay, all right. Well, guys, we are getting close to the top of the hour. We still have a pile of questions to get through. The panel members, are you okay hanging on for a little bit? And Donna, if you want to pick, a handful of the questions and we could kind of run through those. And then I also want to let people know that we're going to have this wearing of the green contest here. So maybe we'll do about 5 or so minutes more of questions, and then we'll have our little contest and stick a fork in it. But again, we do these discussions every month. So we'll work on reconnecting. So what do you think? Anything on the list there, Donna, that looks good? Whoops, unmute yourself.
Okay, sorry about that. So hi, Patty Ross. Patty Ross asked the question, is one of your roles working with supervising the caregiving agencies that provide caregivers?
I love that question.
Go ahead, Kate.
I love this question because we aren't actually the employer of the caregiver. In my group, we do not have home care. We don't have a home care agency within our agency. So we only do care management, but we do a lot of coaching of those caregivers. And we do, if the caregiver isn't the right fit, we're absolutely going to talk to the agency and say, hey, this isn't the right fit. Maybe this person needs more training in Alzheimer's or dementia care, or they're just not the right personality. But we also believe that we really have to support those individuals when they're in someone's home, and maybe bring them Starbucks on the way there, or something to help them because it's a long day.
We also have a unique program. We are subscribers to the Embodied Labs program, which is a virtual reality experience of various types of dementia. And so we use that when we have caregivers who are really struggling to understand a behavior of our client. Maybe they're having delusions and hallucinations. And so families have sometimes had us come in and do one-on-one training with the caregivers who are already in place to help them understand better how that client is seeing the world and how to better approach them to be more successful in their caregiving.
And as a care manager, and if there's caregivers from an agency in place, there can also be private duty caregivers in there. So that presents even some bigger challenges, but it can be done. And I, as a care manager, it's important to be able to clarify with the client and the family members kind of what that protocol is, but I clearly see, you know, I'm not the supervisor of those aides from an agency, but I am extremely instrumental in making sure that they're successful in providing the care that that client needs. And so I really, I continue to be puzzled as why there's not a greater referral relationship from home health agencies and or skilled home care agencies to aging life care managers, because it just is a nice fit. You know, we're not competing against anyone. We're there to provide a service that you don't provide. And so once we get past with home health agencies, look, here's what I'm bringing to the table. It's not anything about what you're doing, but understand that I'm going to be extremely involved in overseeing you know, globally, how the caregivers are doing what they're doing. And if it's not working, you're going to hear from me, because you pay a lot for that service. You know, they're paying me to make sure that I'm advocating for that person. So while we're not directly responsible for that agency caregiver, we are truly responsible to the client to make sure that they're getting what they're paying for.
Maybe Donna, you want to pick a couple more questions, and then we will
Sure.
go to our contest here.
Absolutely. Let's see. Patty, did I read Patty? I did. I want to just say that Janina Di Vittorio said she was present for a comprehensive assessment of a friend with ALCM with ElderTree. She was so impressed with the interaction of Kate's team with the client and family present, and also the very thorough report of recommendations for her care. So that was just a nice endorsement. Janina has worked with many, many care managers. So thank you, Janina, for that. This question is kind of complicated, so I'd love to bring this up. It's from an anonymous attendee, basically asking about insurance. So insurance is so complicated, intricate, and involved and interesting. Some Medicare Advantage plans offer senior care options as part of their program, and these programs offer assignment of and placement with a geriatric care coordinator. So many moving parts and so many different people and so many questions. So things and care gets stuck and frozen because we do not understand all these different people, plans, parts, and pieces. Do you work with these geriatric care coordinators provided by insurance plans, or are you able to serve as that particular healthcare person? Thank you so much. I hope you understand the question and that the question isn't too complicated.
Yeah, no, that's a good one.
That's a good one.
Good one. So I think that's really an evolving situation right now. And what we're seeing is that there are those, you know, what I mentioned at the very beginning, those case managers that may be assigned through your insurance, but they tend not to be folks like us who have boots on the ground. They tend to be somebody who's working from a phone bank somewhere and who's for you. And so as those Medicare Advantage plans start to increase their services, we're going to be watching to see how much is really there, you know. Where's the beef, as they say, and are you really getting, you know, that big bonus that you think you're getting? So we do often have conversations with folks about what their insurance is now. I don't pretend to be an insurance specialist, but as we talk about their needs and maybe their Medicare Advantage plan is working really well for them, in which case you want to keep it, but maybe they're moving to the community. And a lot of times when you're in assisted living, that Medicare Advantage plan is not working as well and your needs are slightly different. And you may want to opt out at some point and go back to your straight Medicare and a secondary through like United Healthcare or Blue Cross Blue Shield. And I would say one of the biggest challenges that we see is when you're in that Medicare Advantage plan, if you need that rehab stay after a pneumonia or hip replacement or something like that, they may be deciding which rehab you go to rather than having that choice. And so that's one of the issues that people don't realize when they're signing up for that Medicare Advantage plan, that they may not have choices in certain areas, which could be really important to them.
Great question, great answer, Susie. And we care managers can help navigate some of those and answer some of those questions. And if we don't have the answer, we will work on getting you the answer. Yes, great answer.
And more long-term care insurance policies cover care coordination is typically how they refer to it. I've seen as little as $150 as your lifetime benefit. So basically 1 hour in your whole life is all you need. And then I've seen plans that has as much as like $7,000 a year
Wow.
that their insurance plan will cover for our costs. So one of the things I do is read that long-term care policy from
Yep.
front to back,
Yep.
help you understand what does that policy cover and how can you use it
Yep.
to meet your needs. Met with somebody a few weeks ago and her policy covers people to come like rake her leaves, shovel the walk, do
Mhm.
handyman stuff. I'm
Yep.
like, this is an awesome policy. She knew it was expensive, but she didn't know all the different ways she would be able to use it.
Great. Well, man, look at the time. We've got a pile of questions, but I'm going to make sure I make copies of them, and I might send those to the care managers, and if they can comment on them when I send the follow-up out tomorrow, we'll
Sure.
include the answers to all that.
Mhm.
But let's do our little contest here. So if you're wearing something green and you want to be considered for the Luck of the Irish contest, raise your virtual hand. You just click on that button there, and I'm gonna do my best to bring you on as a panel member, and we're gonna take a look at you. And this will be a great way for us to all feel like we are in the bar that my background is revealing there. And we will.
Oh, I love it.
There's a lot of people wearing green here.
Some serious green going on here.
Boy, a lot more than I expected. Okay, this might be kind of difficult.
Hey, Patty.
Okay.
Okay.
Come on. Here we go. All right. Okay. Let me get a couple more here. Holy cow. Wow. I thought it would be one or two, but we really,
I love it. I love Georgette.
this shares our, just how large our Irish demographic is.
It is southeastern Pennsylvania.
Yeah. Holy cow. Okay. All right. So there we got everybody who's got their, that's it. I'm not taking any more. Looks like we got
Oh my God. Oh, Karen,
people here.
Bob.
So
I love it.
let's see.
Oh, there's Ellen with the green. Okay.
Hold on.
I love it.
I was wearing my green shirt even before the meeting started.
Me too.
Okay.
It just happens to be my Alka green shirt.
There you go.
Great. Okay.
I love it. Georgette
right.
is awesome.
Okay, so
Harry.
Susie, since your last name is Murphy, I'm gonna let you take a peek at what you see on the screen here and give us our first place winner.
Well, it's tough because they are all really great, but I've got to give props to Georgette. She knocked it out of the park.
Okay, so
It looks like she's
Georgette,
carrying it in the car, driving around the beltway.
I love
okay,
I
All right.
love it.
And I'm
so here's the good news. Georgette, you can claim that you are the official first place winner, but all of us are hopefully going to be winners, because what I'm going to do is I'm going to go out and I'm going to buy 21 Mega Million lottery tickets today, $21 of Mega Million lottery tickets. And I'll send all of you guys the numbers. And on Friday, if we all win, we'll split it 21 ways. And
Love
boy,
it.
we're going to be on the news too. You know,
I
it's
love
going to
it.
be
We're going to be on the news.
But Georgette, you are the official winner today. And I got to figure out how I'm going to copy all these names.
Hey,
here.
Steve, if
Yeah.
we win and we're on the news, that's going to be, Patty, to your point, that's going to be some great advertising for aging life care managers.
There you
Oh,
go.
You bet.
Okay, I love
That'll
it.
be media.
That's it.
Yeah.
That's it. The
So,
media.
So anyways, this has been a lot of fun, guys. And
Been great.
and it's an illustration of how important you are, is that we didn't get to all the questions. So don't worry, we're going to follow up with everybody. And I am really thrilled that we have started this program here.
And
You know
Steve,
what?
is there time for my Irish joke?
Oh yeah, absolutely. Hit us with your Irish joke.
I have a really bad one, and I don't know if I want to tell it on here, so you do it, Susie.
So I'll do it too. And my great grandfather emigrated from Ireland, so I'm as Irish as they come. So what's Irish and stays outside all winter? Patio
Anybody on the
furniture.
panel know?
Patio furniture.
Patio furniture. They're very good.
Okay.
You can tell
Thanks,
that,
Susie.
that joke with your kids in the room, your grandparents.
Joke.
I want to give one little last plug to this profession, if I may. I won't tell an Irish joke, and I don't have the lineage that Susie does. But if any of you know Kay Hyberg Bransford, who's a real rock star in our industry and has really done amazing things with her memory bank business and daily money management and starting a village in McLean. I invited her. She was the first speaker I had at Grand Oaks. And I asked her to do a David Letterman list because she cared for both of her parents whom have Alzheimer's, and this is public knowledge. And I asked her to do a David Letterman list about things she knows now that she had known then. And number one on her list was she wished she would have hired an aging life care manager so that she could have remained the daughter and not been the caregiver. So if you know Kay, you should tell her that I said that, because I think that's like the best commercial for what you guys do. And
That's
I can
beautiful.
speak from experience in a community to the value of what these people do once someone is placed inside of a community. And I want to tell you, Susie provides care for a number of our residents and her team in this building. And I can speak to any of you about what the value is of an aging life care manager inside of a community for a resident. I'm happy to do that. So thank you for indulging me.
Beautiful. Well
Yeah.
said. Thank you. Thank you so much.
Yep,
All right,
it's true.
guys.
Thanks, Steve.
Well,
It is
Thanks,
true.
it's been great.
Donna.
We'll follow up with everybody, and we'll see you next month for 3 more care managers. And
That's
tune
great.
in tomorrow to meet the elder law attorneys.
Thanks,
All right,
Steve. And
guys.
pick winning tickets. Winning tickets, Steve.
Thank you.
Yeah,
Winning
don't
tickets.
worry.
Thank you,
Yeah.
guys.
All
God
right.
bless.
Thank you.
Thank you,
$190 million
everybody.
is
Bye.
today.
Thanks, everyone.
Bye.
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 Bye.